Malaria is common parasitic infection. It is caused by Plasmodium parasite. You can see this parasite into erythrocytes, and it is transmitted by mosquito bites. This mosquito is called Anopheles. It bites person and transmits this disease. Malaria is common in South countries, especially South Asia, Africa, and South America. Previously, it was common almost everywhere in subtropics, but nowadays it's more common in South countries. Very characteristic symptoms malaria has, it's cyclic fever. Cyclic means sudden coldness followed by rigor and shivering, then fever and sweating, and it lasting 4 to 6 hours. So we have fever 4 to 6 hours, then we have no important symptoms, then fever again after 48 hours. So we have this cyclic symptoms. Cyclic means, and at this case we have no symptoms here, we have symptoms here, no symptoms, and symptoms again. So this gap between symptoms is 48 hours usually. Some cases it can be 36 hours, and some cases it can be 72 hours. It depends on types of Plasmodium. So different types have different intervals of symptoms. Most important and most deadly variant have 48 to 36 hour intervals of symptoms. So this symptom starts every 36 hours or every 48 hours and lasts 4 to 6 hours. It's cyclic fever, sudden coldness, shivering, sweating, fever, which lasts 4 to 6 hours. And why it happens? What is why it happens? What is mechanism of action? When this parasite infects a person, it travels to liver first. It multiplies in livers. From liver, it travels to blood cells, erythrocytes, and in erythrocytes it matures and multiplies also, and eventually bursts. And when it ruptures these erythrocytes, release lots of toxins and new parasites, and it causes symptoms. So this rupture of erythrocytes causes symptoms. That's why we have cyclic symptoms, because this cycle of parasite. That's why we have cyclic symptoms. Now let's say about diagnosis. Golden standard of diagnosis is microscopic examination of blood smear and identify parasite and its species. And we have also rapid diagnostic tests. It like a pregnancy test, stick test. This test identifies malaria antigens. That's why it's effective and very fast. Which is most severe type of malaria is Plasmodium falciparum. That's most deadly, and pregnant and children under 5 years are most vulnerable segment for malaria, and they can be more severe on such segment, and they can cause death, and it's not uncommon. Now let's say about treatment. Important is that this is treatable condition, and artemisinin based combination therapy is first line treatment, especially for Plasmodium falciparum, which is deadliest form. Chloroquine also used in most types, and treatment lasts 3 to 7 days. Usually no serious complications with treatment, of course, and prognosis usually is good, but some types of Plasmodium can survive and live into liver. That's also possible, but usually it's treatable and no any adverse effects or any serious effects. that's all I wanted to say. Thank you for your interest, thank you for your watching, and please consider, if you're going to traveling subtropical or tropical countries, especially south part of earth. Thank you for your interest. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.